name is Danielle. This is Lisa. She's going to be observing my speech today. So what I'm going to cover with you is how to properly perform cardiopulmonary resuscitation, which is also known as CPR. I really want to get across the importance of CPR. This video is not going to make you a certified CPR provider, so hopefully it just inspires you to go out and become a provider. Let's start by saying, how many of you would know what to do if a child or a spouse went into cardiac arrest at home? The first thing you should do, obviously, is call 911, but what can you do between when you've called 911 and between the ambulance arrives? This is when CPR can be provided by a bystander. Performing CPR greatly increases the victim's chance of survival. A recent study by the National Institute of Health shows that CPR is effective in victims who suffer from non-traumatic cardiac arrest, such as a drowning, an electrocution, or choking. When an individual suffers an out-of-hospital cardiac arrest, survival greatly depends on a bystander performing CPR. According to the American Heart Association, less than 1/3 of individuals get the CPR that they need because bystanders are either untrained or they're afraid of harming someone. Nearly 383,000 out-of-hospital cardiac arrests occur annually, and 88% of those occur in the home. I've been approached by coworkers and people throughout the community who I've taught CPR to, and they tell me how they use CPR on a family member recently after attending the class. Just the other day, one of our IT specialists came up to me and said he saved his niece who was choking. He was the only one who knew what he was doing. He was the only one who remained calm, was able to help save her life. So, like I said, my name is Danielle. I've been an instructor for 8 years. Initially, I was strong-armed into becoming an instructor. I was very young in my medical career, so I didn't feel like I should be teaching people CPR. But as I became more advanced in training, I was using CPR more regularly. I actually enjoy teaching, and I know the importance of getting CPR trained. So what I'm going to cover with you is knowing when CPR is needed, terminology and materials that are used, knowing and completing the steps of CPR, optimal hand placement, victim placement, and the rate and ratio for compressions and breaths. So when I say knowing when CPR is needed, I mean knowing that this person is unconscious, their heart is not beating, they're not breathing on their own. So to assess them for their responsiveness, you're going to gently shake them, call their name, to see if they wake up. If they do not wake up, you want to do what's called look, listen, and feel, head tilt, chin lift, and you're going to look, listen, and feel. So you're going to put two fingers down on the bony part of the jaw, one hand on the forehead. You're going to tilt this head back, and you're going to look at the chest to see if there's any rise and fall. You're going to feel on your cheek if there's any movement of air, and you're going to listen for movement. So you're going to go like this. Looking at the chest, feeling on my face, and listening. If I don't hear anything, then I know that 911 needs to be called and other steps need to be taken. So some terminology before we get into the actual hands-on. When I say compressions, I'm talking about compressing on this chest, compressing that heart, getting the blood flow to the brain and to the heart. Rescue breaths are the breaths that the rescuer gives to the victim. Like I just said, the rate and ratio. The rate is how many compressions you're going to give per minute, and the ratio is the compressions to breaths. So in adult CPR, it is 30 compressions to 2 breaths. A pocket mask is something small and handy. It comes in a little case like this. You can keep it in your car, keep it in your purse. Pops out, has a one-way valve on it, so what you breathe in isn't going to come back out at you, and it's a good barrier. The AED, or automated external defibrillator, is seen everywhere. They're in malls, airports, grocery stores. This is what really is going to save the person's life because their heart has gone into an irregular beat, and this needs to correct it with electricity. So hand placement is very important. I can't show you all the important steps of hand placement in this video, but it's very important to know that it's important for the perfusion and for victims' injuries. You want to make sure that you're just over them, compressing up and down so that the ribs aren't going to break on you. You also want to make sure you have the optimal hand placement and body placement so you're not getting overly tired. So position the victim's head, make sure the airway's open. Position yourself by placing the palm on the lower half of the sternum, interlocking your hands, locking your arms, and putting your shoulders directly over the chest. And you're going to be pushing down about 2 inches with each compression. So I'm going to go through with you a couple cycles, and I'm actually going to do it with the AED. Like I said, it's 30 and 2. I'm putting the palm of my hand down here, and I'm going to do 32 breaths and put the AED on. Eight, 29, 30 breaths. Right back to compressions. As soon as the AED arrives, you want to put that on. So you plug it in, turn it on, put the pads where they say to go, and just do what the AED says. It will tell you not to touch the patient. It will tell you to do CPR. It will say no shock advised. This isn't going to shock you if you're doing compression. Someone has to actually push the button for it to do a shock. So we went over the importance of CPR, some common terminology and materials used. We went over rescue scenarios, some statistics for cardiac arrest. I showed you how to properly assess a victim, and hopefully this gets you inspired to go out there and be a trained CPR provider. Thank you.